Hi, my name is Dr. Santosh Tiwari. I'm a practicing physician and diabetologist at Sri Siddhi Multi Speciality Hospital, Guwahati. Today we are going to talk about diabetes. First, what is diabetes? Diabetes is a state of chronic hyperglycemia. Means your blood sugar levels are continuously high over a long period of time. When your blood sugar levels are more than 100 milligram per deciliter in fasting state, or if it is more than 140 milligram per deciliter in a postprandial, that is 2 hours after breakfast, then it is called as diabetes. Even if your blood sugar, random blood sugar level, that is blood sugar level checked at any time of day, is more than 200 milligram per deciliter, then we can say that patient is suffering from diabetes. Second, what are the types of diabetes? There are multiple types of diabetes. There is type 1 diabetes, there is type 2 diabetes, there is MODI, there is LADA, but most common types are type 1 and type 2. Type 1 diabetes is very common in young children, yeah, adolescent boys or girls. It is because of autoimmune destruction of pancreas or pancreatic cells, which are responsible for production of insulin. Insulin is a hormone which regulates blood sugar level in your blood, in your body. If your insulin levels are low, then your blood sugar level rises. So in type 1 diabetes, there is autoimmunity, that is your own immunity destroys your pancreatic cells which are responsible for production of insulin. Type 2 diabetes, it is very common. It is 90 to 95% of the patient, they are suffering from type 2 diabetes. Type 2 diabetes is because of either lack of production of insulin, or if insulin are produced in sufficient amount, then it could be because of insulin resistance. That is, insulin is not able to act properly on the peripheral cells which utilize glucose. So the net result is chronic hyperglycemia, that your blood sugar levels are chronically on a higher side. How we can test diabetes? There are multiple tests. First, you have to go test name as blood sugar fasting and PP levels. That is, your sugars are checked in fasting state and 2 hours after taking your breakfast. And there is one HbA1c test. HbA1c is also called as glycosylated hemoglobin. It determines your last average blood sugar levels of your last 3 months. So if you are suffering from diabetes, your doctor will also advise you another test such as liver function test, kidney function test, ECG, 2D echo, other tests to see whether there is any other side effects or any damage done to the body by raised blood sugar levels. The last thing I want to speak is what are the symptoms of diabetes. Diabetes, whenever a patient is suffering from diabetes, he may have following symptoms: increased thirst, increased urination, increased appetite. In spite of increased thirst and appetite, there is loss of body weight. Approximately 4 to 8 kg of body weight is lost in undiagnosed diabetic patients. Then increased risk of infections or increased frequency of infection. Patient might be having severe weakness. These are the few symptoms of diabetes. Thank you.